Hello and welcome. I'm Dr Jasmin Malik, a GP in Camden and North Central London and the North Central London GP Clinical Lead for Health Inclusion. Thank you for taking the time to join this session and for supporting such important life-saving work. Participation in cancer screening is vital. Early detection means treatment is more likely to be effective and successful, helping to save more lives. In this session, you'll hear from colleagues across each of the 4 national screening programmes: breast, bowel, cervical, and lung. They'll explain how each programme works, who is eligible, what participants can expect, and what reasonable adjustments are available to make screening accessible to everyone. You'll also hear about the key role you, as professionals, can play in encouraging your clients, patients, and communities to take part in screening. We know that some communities are less likely to participate in screening. This includes people living in areas of higher deprivation, those with significant mental health conditions, learning disabilities, physical disabilities, or chronic illness, people experiencing homelessness, individuals who are agoraphobic, anxious, or housebound, those from whom English is not their first language, and survivors of sexual abuse. That's why it's so important that everyone, and especially those from underserved groups, is aware of the reasonable adjustments available to support them to take part. Anyone can discuss any aspect of the screening programme with their GP or another healthcare professional. And if someone notices a change in their body, even if they recently had a screening test, they should always contact their GP.
Hi, my name is Mansi Tara, and I'm the Health Promotion Lead for the North London and Central and East London Breast Screening Service. Today, I'll be speaking to you about breast cancer awareness and breast cancer screening and why it is so important. So, regular breast screening can find breast cancer before an individual notices any changes or any signs and symptoms. And finding cancer early can make it more treatable. Breast screening uses X rays, which is called mammograms, to look for cancers that are too small to see or feel. So, all women, trans men, trans women, and non binary people between the ages of 50 and 71 years are eligible, and women over the age of 71 can request a mammogram by self referral. Women are sent their screening invite every 3 years, with their first invitation being issued anytime before their 53rd birthday. So, anyone who's registered with a GP as a female will be sent an invite between the age of 50 and 53, and then they will be sent an invite every 3 years up until their 71st birthday, after which they can refer themselves into the program every 3 years. The invitation letter is sent via post, and the screening site that's chosen for the individual is within 30 minutes via public transport. It's a timed appointment, so the appointment time, date, and menu is fixed, but the women can call and change any aspect of that appointment for their convenience. Trans men, trans women, and non binary people registered as male with their GP practice will not receive an automatic invite. Individuals who think that they should have breast screening should talk to their GP. So let's talk a little bit about breast cancer. Breast cancer is the most common type of cancer in the UK, with 1 in 7 women will be diagnosed with breast cancer in their lifetime. It is more common in women over the age of 50, but it's not all gloom and doom. Breast cancer screening does detect cancers early. So in 2022-23, we diagnosed over 16,000 breast cancers, and screening saves 1,300 lives each year. There are some things that people can do to reduce their risk of getting breast cancer by 23%. And some of these things could be improving their lifestyle, which could include a healthier diet, reducing their alcohol intake, but also adding movement to their day, so exercising regularly. This doesn't mean that we expect people to go and join the gym for an hour every day. I wish I did that. It's more about maybe getting off a stop early on the tube or the bus and getting moving through the day. So let's talk a little bit about breast awareness. Breast awareness is essentially getting to know what looks and feels normal for you and then notice any changes from normal. People of all genders and ages can get breast cancer, so it's very important for everybody, even men, to practice chest awareness. And everybody's normal is different. You know your body best. There is no right or wrong way of practicing breast awareness. What we do recommend is practicing regularly. So, once a month, around the same time of the month, check your breasts or chest. And a technique that we recommend is TLC, which would be touch. So, touch your breast or chest and feel for any lumps or any unusual changes. You can do this in the shower or while you're getting changed. We would recommend going all the way to your collarbone and to your armpit because our breast tissue extends to these areas as well. The other thing to do is look. So while you're changing, look in the mirror for any unusual changes from normal. And I'll go over the changes in the next slide. And if you see any change from normal, get it checked by your GP. So the common signs of breast cancer include a lump or a swelling in the breast, upper chest, or armpit, a change to the skin texture, it could be puckering or dimpling, a change to the color of the breast, it could look red or inflamed or hot to touch, any changes in the nipple, it could become inward or change direction, there could be crusting around the nipple. Any unusual liquids or discharge that are coming out of the nipple should also be get checked out, and any change in shape or size of the breast. While breast pain on its own is not considered a sign of breast cancer, but if you have pain all the time or almost all the time, we would recommend going to your GP and getting it checked out. So the changes that have been mentioned here might not, there might be changes beyond these that you might notice. That's why we say get to know your body, see what's normal for you, and if there's any change, and if it's anything of concern, please go to your GP. Because again, to emphasize, the earlier that we find any changes, the easier it is to treat. So, what is breast screening? Breast screening helps us find changes in your breasts that are too small to see or feel. You might practice breast or chest awareness monthly, but there are some changes or that might not be you might not be able to feel or see. For this, we invite women between the after the age of 50 for breast screening. So anyone registered with a GPS female will automatically be invited every 3 years. At breast screening, you will be seen by a female mammographer always. They will position your breasts on this mammography machine, as you see the black plate on the screen, and the white plate is brought down to then flatten your breast a little bit and hold it in place for an accurate image. We do recommend women to wear skirts or trousers on the day of their appointment for the ease of undressing. The mammographer will go on to take two x rays of each breast, one top to bottom and one sideways, because we want to get an accurate image of the entire breast tissue. The whole appointment lasts about 6 minutes. Some women find it okay, some find it uncomfortable, and sometimes women can find it painful, but we do say that it is 6 minutes that could change your life or save your life if we do find that cancer early. So this image puts the breast self-examination versus mammography in perspective. So the bottom pink dot that you see is what a woman might find when they practice breast awareness. The second dot that you see is what a healthcare professional or nurse might find when they are checking your breast. As the dots get smaller, that's what we find when we do mammograms for you. And if you come for your regular mammograms, because we compare your films to the last mammogram, we're able to find changes that are very, very small and much easier to treat. So we recommend that women come for their mammograms regularly every 3 years. While you're invited for mammograms, we also recommend that you continue practicing breast or chest awareness because it's very important to find any changes even in between those screening appointments. So, breast screening uptake is low in some communities and some vulnerable population groups, though their chances of developing breast cancer is the same as the rest of the population. And some of these groups include people with learning disabilities, people experiencing homelessness, people with severe mental illness, ethnic minorities, such as the Black and South Asian communities, and the LGBTQ plus population. There are some reasonable adjustments that are offered by the screening services to ensure that these vulnerable groups have a comfortable appointment and are come to their regular screening as well. Some of these adjustments include bringing along a carer, a friend, or a support worker to the appointment. If someone does not speak English as their first language, we have language line services, but we also have iPads with Google Translate at the screening sites for a three-point identification. So if someone doesn't speak English, that shouldn't stop them from coming for their screening appointment. For people with learning disabilities and people experiencing homelessness, we also offer pre visits, which is an opportunity to come to the center, see the machine, get to know the team, and familiarize themselves with the appointment to relieve any anxiety they might have. We also offer longer appointments, so twice the length of a regular appointment for vulnerable populations. And if eligible, support can be provided to book transport to the screening site. Information can also be requested in easy read or other languages, depending on the need. We have put the contact of the breast screening hub on this slide, and they are the ones who are responsible for scheduling appointments across London. So, how can you help? We usually request people to keep easy read resources in their waiting areas. The health promotion team would be very happy to come and do awareness events for vulnerable client groups and their carers. We have resources in different languages, in different access needs as well. And we tailor our presentations and duration based on the event that we're invited to. Can also ensure service users and the carers are aware of the reasonable adjustments in place and how to access them. The contact for the health promotion team is on the slide as well, if in case you'd like to partner with us.
My name's Tom Smith. I'm the manager of the Bowel Cancer Screening Centre, which is based at UCLH, but serves the population of North Central London. I want to talk about bowel cancer screening, and in particular, how we encourage everyone to complete the kit. Why is it important? Because bowel cancer screening is one of the most common types of cancer in the UK, and screening can help prevent bowel cancer or find it at an early stage when it's easier to treat. The kit that we send you looks for traces of blood in your poo. Bowel screening is for everyone aged 50 to 74. The kit's sent every 2 years and it's sent to people's home address, the one that you've registered at with your GP. It may help to explain bowel cancer screening by going through 7 questions. Who is sent a bowel screening kit? What does the kit look like? How do you complete the bowel screening kit? What happens after you complete the kit? What adjustments can we make for those who need them? Why doesn't everyone complete the bowel screening kit? And finally, why should everyone complete the kit? So first of all, who is sent a bowel screening kit? Well, since bowel screening was established, the age we cover has extended at both ends. First, we went up from 70 to 74. Then, in a series of steps which ended earlier this year, we've lowered the starting age down to 50. All men and women aged between 50 and 74 who are registered with a GP in North Central London will be sent a kit automatically every 2 years. So if people move, it's really important they update their address with their GP. Men and women over 75 will not automatically be sent a kit, but they can ask for one. We call it opting in, and they can do that by calling the free phone number you can see on the screen. And if a person has been sent a kit, but it's been misplaced, they can also call the same free phone number and ask for a new one to be sent to them. A GP practice can request a kit with the patient's consent and ask for it to be sent to a patient that's registered with them. So what does a bowel screening kit look like? It will arrive in a small box with a perforated margin. Opening the lid will show a small rectangular case with some instructions on how to complete the kit printed on the lid. The small case is about the size of a USB stick and it opens in a similar way. Pulling off the green top will reveal a thin stick attached to it and the clear part, the case that's left, has a small amount of liquid solution within it. Once a small sample of poo has been scraped onto the thin stick, it can then be clicked back inside the clear case and returned, and a free post envelope is provided. The kit comes with a letter, and that explains the process. The letter has a QR code which links to a more in-depth patient information leaflet, and a free phone number is given if the recipient would like the information to be given in a different format, a different language, in Braille or in an easy read format. How do you complete the kit? The key thing is to catch the poo before it hits the water, and there's more than one way to do this. Cancer Research UK have provided a helpful illustrated guide with some suggestions. 3 ways to do this are: 1. Put layers of toilet paper around the bowl to catch some poo. Put some cling film across the toilet bowl above the water. Or place a plastic box, like the ones that washing pods come in, within the toilet. So to complete the kit, you'll need the kit, which is the USB type tube, some toilet paper, plastic box, cling film, whichever method you choose, and a pen. The pen is for writing the date on the outside of the kit once you've used the thin stick to capture a small amount of poo. The thin stick just needs to be coated with poo at its end. Then pop the stick back into the plastic tube, the clear case, use the pen to write on the date, put it in the envelope provided, and post it. So what happens then? The envelope's addressed to a laboratory. It's in West London. It will arrive within 2 days of the sample being posted, and it will be processed the same day it's received. A machine will detect whether there's any blood in the poo sample. If there's a certain amount, an appointment will be made that day with a specialist nurse in our team, and you'll be posted a letter with an appointment date. The appointment will be by phone and will involve a 45-minute conversation with a specialist nurse. For every 100 kits returned, 98 will not have an amount of blood that triggers a referral. About 2 in every 100 kits has the amount of blood that would trigger a referral. At the appointment with a nurse, they'll ask you about any symptoms you might have, about medical history, about medications that are currently taken, and they will ask whether you have someone who can escort you to have a test. That can be a friend, a family member, or a support worker. The nurse will offer a test which is known as a colonoscopy. This is a long tube with a camera at its end. It will be inserted into your bottom and will look for polyps, which are small abnormalities, growths in the bowel, and they can be removed during the test and sent for further examination. Not everyone has polyps, and not all polyps are dangerous. Some polyps, however, can grow into cancers, and in many, many cases, we remove polyps before they become a problem. About 61% of people that are sent a kit in our area complete it. Although this varies, it varies across the different boroughs. Camden is the lowest in NCL. It also varies across certain groups. There are particular issues with people experiencing homelessness, people who have severe mental illness, people with learning disabilities. Those groups are all less likely to complete the kit. More generally, common reasons why people do not complete the kit are not being registered with a GP, it not feeling like a priority, people who have concerns about the procedure, about the risks. Men are less likely to complete the kit, though they're more likely to test positive. There are concerns about the cleanliness of the kit. Some people are not able to make an informed decision. And if people don't have symptoms, they're not sure they need to complete the kit. Also, because the kit is sent to people's homes, it's easy to set the kit aside, put it in a drawer, and forget about it. Some people don't complete the kit because they're scared of results, and some because the instructions are in English, and that's not the first language of all. Some people are unable to read or follow the instructions, and for some there are practical barriers. There are a number of adjustments that can be made for people who need them. We can slow down the normal pathway and offer multiple appointments for those who need additional support ahead of any test. Support workers can attend nurse assessments. In some cases, we may offer an alternative test for those who aren't fit for a colonoscopy or for those who are incredibly anxious or reluctant to have a colonoscopy. The alternative is an X-ray of the bowel, known as a CTC. However, if that X-ray shows an issue, then a follow-up test will be needed. We can arrange special appointments to explain bowel prep, which for many is the least pleasant part of bowel screening, the medicine you take that cleanses your bowel ahead of the test. When people need it, in extremis, we arrange for a hospital admission to support people ahead of the procedure. Some tests can be done outside of UCLH. We offer colonoscopies at UCLH, at the Whittington Hospital, and we're working to start them at Chase Farm too. Blood tests can be done locally. Although most assessments and results are given by phone, we can hold face-to-face appointments for those who need them. And there are leaflets explaining the process in different forms, in easy read format, in different languages. So finally, why should people complete the kit? Well, simply put, it saves lives. The man on screen is a consultant surgeon, Mr. Austin Obercherry, and he's our director of screening. He says, if you receive a bowel cancer screening kit, use it as soon as possible. You could stop cancer before it starts. We do find cancers, perhaps 70 a year, but much more often we find polyps and remove them before they have the chance to grow into anything more sinister. Bowel screening saves lives, and we want as many people as possible to complete the kit. Please do complete the kit if it's sent to you. Thank you.
Hi, my name is Asha and I am part of the North Central London Cervical Cancer Elimination Team. This talk is about how we can provide reasonable adjustments for our patients to improve cervical cancer screening and get one step closer to cervical cancer elimination in the UK. This slide is a summary slide on the cervical screening programme and can be used for your reference as you need it. So, what is cervical cancer? Cervical cancer is a cancer of the cervix in the vagina. It currently leads to approximately 685 deaths a year in the UK. The cervical cancer screening test is more commonly known as a smear test, and this allows us to detect human papillomavirus, which in this talk we will now call HPV. If we find HPV, we can also look for precancerous cells and any cell changes that could then lead to cancer. Early detection means that there is an increased likelihood of successful treatment. The eligibility of this screening test is for all women, trans men, and non-binary people who have been assigned female at birth and have a cervix. The age range for this is from 25 years to 64. Some trans men and non-binary people have a cervix, depending on their phase of transition. They are not automatically invited for a cervical cancer screening test. This means that the GP surgery needs to be informed of this so that they can opt them in for routine recalls. The UK aims to align with the World Health Organization's global initiative to achieve below 4 per 100,000 cervical cancer incidence rate through HPV vaccination and increase in cervical cancer screening. Here are the UK stats. Cervical cancer is most common in the early 30s. 5,000 lives are saved each year through cervical cancer screening. and just over 3,000 people are diagnosed with cervical cancer every year. This video is for reference, and it is a really easy to watch video for your clients and your patients to explain to them how cervical cancer screening tests are conducted. You can access cervical screening at your GP surgery or sexual health clinics. The sample may be taken by a nurse, nursing associate, physician associate, or a doctor. Results will be sent to the NHS app in a new drive of digitalisation. However, if the result is not read within 3 days, a letter will be sent to the patient in the post to the patient's registered address. However, if a patient does not have internet access, a smartphone, the NHS app, or fixed abode, then it is so important for them to let the clinician know. So that way we can make reasonable adjustments to ensuring that you get your results. A result can be negative, so that means there's nothing to worry about and the next test is due in 5 years' time. If a result is positive for HPV, but there are no cell changes, the next test is in 1 year's time, as our body can normally remove the HPV infection by itself without causing any cell changes. If a result is positive for HPV and we've got cell changes, this means that the patient needs to attend the hospital for colposcopy. In this appointment, they will remove any abnormal cells and ensure that you are followed up. This prevents those abnormal cells from turning into cervical cancer. Sometimes, and this is very rare, the result may come back as inadequate. This can sometimes be because there's an underlying bacterial infection or some other reason. This means that we have to repeat the test in 3 months' time to allow these cells to regrow so that we can get the most accurate reading of your cervix. Human papillomavirus. It's such a common virus and normally it doesn't cause any issues as our bodies is normally very good at removing them. Some types of HPV can cause warts and some types of HPV can cause other cancers such as cervical, anal, mouth or throat cancers. We cannot treat HPV using antibiotics or antivirals. Persistent infection with high-risk HPV can cause cellular changes in the cervix, and this is why it is so important to go for your screening test when you are invited. High-risk HPV infections are responsible for over 70% of cervical cancers. So once again, catching it early means that we can treat successfully. The HPV vaccination is offered to all from year 8 to their 25th birthday, or for men who are having sex with men until the age of 45 years. This is proven to be a driving factor for us to be eliminating cervical cancer within the UK. What the vaccine does is it prevents infection and reinfection of numerous different types of HPV. This is a slide on the eligibility of the HPV vaccination. So those who are aged 12 to 25 can have theirs done with School Vaccination UK or at the GP surgery. Those who are gay and bisexual men having sex with other men can have theirs at the sexual health clinic. And those who are immunosuppressed will be instructed to have this vaccine by their consultant, and the nurse at the GP surgery will often be able to give this to you. 1 in 3 people who were invited did not go to their screening appointment, and the number of non-attenders are lower in the following groups. Those who live in an area of social deprivation, people with significant mental health issues, those with learning disabilities, those with physical disabilities or chronic illnesses, people who are agoraphobic or anxious, those who are housebound, anyone who's got English as a second language, and people who have survived sexual abuse. Some of these barriers are physical. An example of this is the patient can't get on the couch or the clinic is inaccessible. Psychological. They might be fearful, there may be some previous trauma, they may mistrust the health system, and actually hospitals and clinics are a little bit overwhelming. Cognitive. Does our patient and our clients understand the purpose of the cervical cancer screening test and the procedure? Systemic. Is it easy to book an appointment? Are the appointment times flexible? Could they do with a home visit and actually that has never been offered to them? Social. If a person doesn't have support or advocacy, it can be really difficult to arrange an appointment. If a person you know has these barriers, it is so important to talk to the GP staff who can help with making reasonable adjustments to make the procedure comfortable and easy. What they could do is they can provide a pre-appointment, they could conduct a home visit, ensure that there is a translator, provide an advocate and support for the patient, and provide information in an accessible manner. We've got to remember about making every contact count. It's so important in certain ethnic backgrounds to be mindful of different concepts that could be barriers where the uptake is low. Somali, Turkish, Bangladeshi, and the Chinese community have low rates of cervical cancer screening uptakes. Young European women are also less likely to access a screening in North Central London. Some common reasons that we know are low access to information in their own languages, lack of interpreter access, low awareness, belief that they are no longer at risk of cervical cancer, particularly if they are married or only have one sexual partner, female genital mutilation, concerns around virginity, and having tests done back home. HealthWatch are a good source of professionals and community voices who can speak to patients who are worried about cervical cancer and help encourage and empower individuals in their decision making. Contact them if you want a non-health professional or a health professional to help with encouraging a person to take part in cervical cancer screening. The links are here. Learning disability. We know that the number of patients accessing all screenings is lower in those with a learning disability, and GP surgeries are working so hard through annual health checks to improve and educate these individuals and their carers to promote attendance for preventative care. You can help too. There are learning disability partnerships across North Central London who often use health champions who are helpful with desensitisation. Please Google the borough and then Learning Disability Partnerships to see what your borough has to offer. For those who have experienced sexual trauma, there is a service based at Mile End Hospital that provides cervical cancer screening, among other gynecological care, in a safe and supportive environment, particularly if it feels way too much for a person to be in an overly clinical, medicalised environment in a short appointment. They offer hour-long appointments and are trauma-informed. This is a reference slide of a trauma-informed, person-centered supportive approach for a lady who has experienced sexual trauma and successfully had a smear test done under the My Body Back project. This is a reference slide of a supportive approach for a lady whose second language was English, and she had supportive discussions to help them take proactive decisions to participate in the cervical cancer screening. And we know that if a person is informed, they are much more likely to engage in healthcare. We know that this is not a glamorous test, but it's so important. So some practical ways to feel comfortable are to wear loose clothing, ask for a smaller speculum, ask for the speculum to be warmed up if more comfortable, bring a friend, ask for a chaperone, and don't forget to plan for a treat afterwards. There have been lots of improvement in cervical cancer screening, and from January 2026, many patients will be offered a self-sampling home kit to check for HPV. If positive, they will need to come to the GP surgery for cervical cancer screening, which is also known as a smear test. If they are negative, they are unlikely to develop cervical cancer in the next 10 years, and they will not need to repeat their test for a few years. However, if ever a person is symptomatic with any sort of vaginal issues, such as abnormal vaginal bleeding, abdominal pain, bloating, or pain after sexual intercourse, they must contact their GP surgeries. Screening tools are not diagnostic tools. Here is a list of YouTube videos which we have made with the North Central London ICB. Here are our take-home messages. Keep talking about cervical cancer screening and HPV vaccination. Early detection is so important to successful treatment. Increasing uptake in underserved populations is the way forward to improving health inequalities for those with a cervix.
Hello, my name is Amy Hemmington. I'm the Health Promotion Lead for lung cancer screening across North Central London. In this session, I'll explain the lung cancer screening programme, why screening is important, and the reasonable adjustments we can make to support people to participate. This slide is just an overview of the programme, so you can refer back to this for a quick summary. Lung cancer is one of the most common types of cancer in England. Unfortunately, the symptoms of lung cancer tend to appear quite late. They're also reasonably non-specific, so it can be easy to attribute to another illness or generally feeling unwell. If you or a patient experience any of these symptoms, the best thing to do is to make an appointment with the GP. Some symptoms that a person might notice can include a cough that won't go away, bringing up blood when you cough, feeling short of breath or particularly tired, losing weight without intending to, pain when you breathe or cough, or a loss of appetite. The screening programme is targeted at people who are not already experiencing symptoms. We now have many ways of treating lung cancer, so the key message is if found early, it can be treated. Treatment options can include surgery, systemic treatment like chemotherapy or radiotherapy. Before we jump into more about the screening programme, let's look at some lung cancer statistics. Do you think lung cancer is more common in men or women? I'll give you a second to think. Nowadays, the number of lung cancers diagnosed in men and women is roughly equal, but this did look a bit different 10 years ago when lung cancer diagnoses were more common in men. So over the last 10 years, diagnoses have increased for women. What's the biggest risk factor for lung cancer? Is it smoking, age, air pollution, or your occupation? Age is actually the biggest risk factor for lung cancer. As we age, there is more damage to our cells, which increases the likelihood of abnormal cells forming a tumour. However, in terms of preventable risk factors, smoking is the #1 cause. Around 72% of lung cancer cases are linked to tobacco smoke. Workplace exposures like asbestos or silica account for 13%, air pollution 8%, and secondhand or passive smoke about 1%. What percentage of lung cancers are diagnosed late? So we'd consider stage 3 or 4. Under 30%, 30 to 60%, or over 60%. So 66% of lung cancers are diagnosed late in women, and 72% are diagnosed late in men. Unfortunately, this has led to lung cancer being the #1 cause of cancer death in England, and hence why we've started screening for lung cancer. Usually there are no signs at the start, which means that it is often diagnosed late and it's a lot harder to treat at that stage. Lung cancer screening catches lung cancer earlier when there's more treatment options, ultimately to try and increase survival. In the majority of people, no cancer is found, but for those that we have diagnosed lung cancer, in the majority of cases, it's been diagnosed at an early stage, which is great to see because it shows the programme is achieving what it set out to do. Unfortunately, though, there are inequalities in access to screening. Cancer screening rates are up to 25% lower in people with serious mental illness, a disability, or experiencing homelessness. We're particularly focused on raising awareness and addressing barriers to access for these groups. Lung cancer screening is for people who are aged 55 to 74 and either currently smoke or used to smoke. We extract data based on this eligibility criteria from GP practices across North Central London. Eligible people will receive a letter inviting them in the post. However, there is the potential for people to slip through the cracks if their phone number or address is changed, or they're not registered as a current or ex-smoker in their GP file. So it's helpful to encourage people to make sure their GP records are up to date. There are 2 stages to lung cancer screening. Some people will only need to do stage 1 if they're deemed low risk. People who are high risk will go on to do stage 2 as well. Eligible people will receive a letter in the post with the date and time for a phone appointment. They'll be given a call by a member of our team who'll ask questions about their breathing, overall health, and family medical history. Based on their answers, we will calculate a risk score. If high risk, they'll be invited to come for an in-person appointment. If someone needs additional support during the phone screening, they're welcome to have a family member or carer present. And if the patient would like to consent for them to speak for them, the family member or carer can answer the questions. The in-person appointment will happen at one of our 3 sites, University College Hospital, the Moorwood Green in the CDC, or Finchley Memorial Hospital, and the patient can choose any of those sites they'd like to attend. They'll meet with a nurse who will ask similar questions to the phone screening, just to make sure nothing has changed, and then we'll measure their height, weight, and blood pressure. If currently smoking, the nurse will also offer smoking cessation support, but there isn't any pressure to quit smoking in order to participate in screening. It is left up to the person. After this, they will recalculate their risk score, and most people at this stage are invited for a scan. This happens on the same day, right after the appointment at the same site. Though, just something to note for University College Hospital, there is a short walk between the nurse appointment and the scan site. The scan we use is a low-dose CT scan, which uses less radiation than a standard CT and so is safer. It's quick and people can eat and drink and drive as normal. There are 4 possible outcomes following screening. Regardless of the outcome, we will write a letter to the person and to their GP explaining the results. We may find nothing concerning on the scan. If that's the case, we will invite them for a follow-up scan in 2 years and continue to scan them every 2 years until they age out of the programme. Sometimes the radiologist will see something on the scan that needs to be checked again. If that's the case, they'll be invited to have another scan in a few months. If we do find something concerning for lung cancer, we'll connect the person with the right medical team to do further tests and diagnosis and treatment. Lastly, sometimes we find signs of other chronic health conditions that people don't know they have, for example, emphysema or cardiac issues. In these cases, they'll be followed up by their GP. We aim to do as much as we can to support everyone to access lung cancer screening if eligible, with a specific focus on increasing access for people who are vulnerable or less likely to access screening. These are some of the reasonable adjustments that we can make. We have easy read information available. We can book a longer appointment or an appointment at the start or end of the day when it tends to be quieter. We can also offer a pre-visit to familiarise them with the clinic environment and clinicians. And we can also make the phone appointment an in-person appointment if that's preferable. They're welcome to bring a support person, and we also have access to interpreters. These are some of the things we can also offer to support uptake of the programme and awareness in the community. We can do education sessions for staff or for service users. We can provide a presence at health events, hosting a stall and giving out information. We have print and digital resources such as flyers and posters that we can share, and we can also give content for websites and newsletters. We partnered with several organisations on projects to increase access, so if this is something that you'd be interested in, then please do reach out to myself. My phone number and email address are on a later slide. For example, we have worked with some organisations around bringing screening into the community. We don't have a low dose, we don't have a mobile CT scanner, so we can't scan in the community, but we can do the first part of screening, the phone screening and the nurse appointment. And we found that by bringing this to local organisations in the community, people are much more likely to participate actually, and they sometimes have a better experience as well because they're able to go to a site that's familiar for them. There are also things you can do to support access and make every contact count. Please look out for people who would fit the criteria and ask if they've had their screening or received a letter. You can inform them why screening is important and also send over the details of people who would like to participate that have either missed their invite or that think they would be eligible and haven't received an invite. I've included our email address on this slide, and our email address is also here and our phone line. The service user is also welcome to contact us directly if they would like to make an appointment. For further information, or if you have any questions, please do reach out to myself. My phone number and email address are here on this slide. There's also further information in these websites about lung cancer and lung cancer screening, and a link to our promotional material as well. Thank you for your time.
Thank you for taking the time to participate in this session, and by doing so, helping to save lives. We know there's a lot of information covered today, so please feel free to revisit this video whenever you need the refresher. Bookmarks have been added so you can easily skip to the section for the screening programme most relevant to you. Please share this resource with your networks and include it as part of the induction for any new team members. You can make a real difference by encouraging your clients, service users, patients and communities to take up screening and to see their GP if they have symptoms. Letting people know that reasonable adjustments are available to support their participation and displaying leaflets and posters in your settings. Also, by inviting our health promotion colleagues to speak with any underserved communities you work with. On the next and final two slides, you'll find key contacts for each screening programme. Please reach out if you'd like further support, as well as links and resources you can use and share with your team. To summarise, your support in promoting screening, sharing the resources and ensuring people know about the adjustments available can help improve access and ultimately save lives. Thank you again for your time, your commitment and your support.